Hello and welcome back to the Fight Back Falls channel. I am physiology, and in this video I'd just like to go through a very common problem, or a problem that's usually associated with getting older, stiffness, joint stiffness. Now, you might ask me, Gail, what does stiffness have to do with increasing my risk of falls? I'm glad you asked, because I'm just going to go through how stiffness affects or can increase your risk of falling. Now, there are different ways or different conditions that may cause stiffness. This includes the very common one that everybody knows, osteoarthritis or arthritis. There's bursitis, things like gout, and something that's called degenerative joint disease. But all these active conditions will result in, or could result in, joint stiffness. So how does stiffness or joint stiffness increase your risk of falling? Well, it depends on the number of joints that are affected and the joints that are affected. A very common joint that is affected, or joints that are affected, would be your hip and your knees, and especially your knees. And so what that does is it could start a cycle where, because you're experiencing stiffness in the joint, you reduce your level of physical activity. But in doing this, what happens is that the joint, it's like a machine. If you don't use a machine for a long time, it seizes up. And so the same thing happens with all joints. And in this video, we're talking about specifically, or more specifically, the hip and the knee joints. So you might find that you go to bed and you wake up first thing in the morning, those joints are stiff. Or you might be sitting for a prolonged period of time, like a long journey, or sitting watching the telly. These are just simple activities that can cause the joint stiffness. And so it's not just the joint which becomes stiff, but the muscles around the joint tend to, the tendons, that's the end sort of harder bit of the muscle, those are called the muscle tendons, and those become shortened as well. So basically your joints become stiff, the muscles around the joint sort of shorten, and then in terms of, if you're, let's say, thrown off balance whilst you're walking, maybe there's a hazard on the floor or an object on the floor that you didn't notice, and your joints are stiff as well, and so you're not moving as quickly as you can. And because you're not moving as quickly as you can or should, as a result of that obstacle or hazard throwing you off balance, then you're more prone to a fall. Just a bit of information, your knee joint is what we call a synovial joint, and these, if you don't move the joint, then the joint will become stiff. By moving the body, or it's designed, that joint is designed to lubricate itself, but it will only lubricate itself if you're exercising, if you're moving it. So this is why it's so important to move, to prevent that stiffness. And in preventing that stiffness, you're preventing or lowering that risk of fall. I'm just checking that I haven't left anything out here. And studies have shown that having stiff joints or joint stiffness could result in increasing your risk of falls of up to 85%. That's quite high. That's massive. When you can do something as simple as just starting to move that joint. The other thing that is it's like a double whammy, is that most times joint stiffness doesn't come on its own. It comes with pain, and you might be prescribed pain medication to help to ease the pain. But again, the medication, you know, some of these pain medications might cause drowsiness. And you can imagine you're drowsy, your joints are stiff, your muscles are probably weak from not moving enough. You know, that's really setting you up for a risk of falling. And, you know, I've mentioned factors here that are modifiable. These are things that you can just modify by moving more. I mean, just a tip in terms of pain, things that you can help in addition to your pain medication is probably just putting a warm pack, whether that's a wheat bag that you can warm up in the microwave. There's so many different heat packs on the market that you can use to warm up the joint. A note of caution: if the joint is warm, you don't want to use heat on that joint, because that could be an indication of active inflammation, and you do not want to, by putting heat on an actively inflamed joint or acutely inflamed joint, can make that inflammation worse. So heat is good if the joint is normal temperature. And I know this sounds strange, but you can use a pack of frozen peas or a cold pack on the joint. If you leave it on for greater than 15 minutes, it then will have a similar effect to the putting heat on. So I hope you found this video helpful, and you now know how joint stiffness increases your risk of falls. Thank you for watching, and remember, do not forget to like, comment and subscribe, and share the video with someone you feel this will be useful for. Thank you for watching, and goodbye.